Okay, hello and welcome. You are at the Mobilize Maternal Health Coalition teach-in number 3, which uh, typically has a really great lineup of topics as well as complementary subject matters that we'd love to have you engaged on. You can find out more on mobilizematernalhealth.com. We are the Mobilize Maternal Health Coalition. We've grown from 2 organizational members to now 12, and we are still growing and hope that more individuals and organizations will join our efforts. If you have any stake in maternal health and improving the legislation and policy, we want you to be a part of this. So today we are going to have 3 topics, one as a focal point. Jessie Workman and Mariah Engelberg are representing a better balance. I'll share more about that momentarily. We also have, today's topic is overall about learning your rights and protections as a pregnant, birthing, or postpartum employee. And I will share more momentarily, like I mentioned. The other 2 subject matters will be sharing about New York State Birth Center Association's official, or let's just say proposed legislative strategy. Now that we are have recently met, we as an organization for 2025, we have some direction that we wanted to go, and also, of course, welcome community input. So that's the second item. And the third will be really exciting. We're all excited to share more about the Mobilize Maternal Health Coalition's Day of Action, which is March 26th. We have some time in Albany on the stairwell, and have a bunch of great supporters, sponsors, and folks who are going to really lend an ear. And we hope that everyone here who's been following along, catching snippets here and there, will find your personal way to be involved, be it virtually or hopefully in person. We'll share more, and we have a forum that we can better understand how you can be engaged, and we'll share ideas on how to do so even if you can't attend in person. Okay, so that's the gist. So what I'm hoping to start with before introducing and handing it over completely to a better balance is the question, and I hope people, anyone within MMHC or who are here today, please answer in the comments, what about workplace rights during the perinatal period is important to you? Like, what brings you here? What do you want to know more about? What about the perinatal period and your rights is important to you? Okay, I kind of framed the question in multiple different ways, but you can direct yourself in the way that is meaningful to you. So I will share now about, and hopefully some comments will trickle in. We highly encourage you to please still comment, because we would love to see this as something to look back to, and also as it's evident that legislators are looking at these videos. To see engagement is really important, and for them to also see what's important to us is also another means of communicating. Okay, so Jessie Workman and Mariah Engelberg from A Better Balance will share insights on your rights as a pregnant postpartum person, and as birth workers. This is relevant to us. If you're a birth worker, say hi in the chat. Let us know who you are, your organization or your business, the area you serve. And Jessie Workman is a staff attorney at A Better Balance, bringing experience advocating for LGBTQ plus rights, healthcare access, workers' rights. Previously, Jessie worked with the Transgender Law Center and New York City Commission on Human Rights. Mariah Engelberg is an organizer at A Better Balance, focusing on improving disability benefits in New York. And with a background in social services and union organizing, Mariah is passionate about fighting for workers' rights and safety. So it is my pleasure to hand it over to Jessie and Mariah for a presentation, which will include TDI content as well, the PUMP Act. You can start bringing them in if you haven't already, Samantha. New York's prenatal leave, the PUMP Act, the Pregnant Workers Fairness Act, and practical steps to receiving workplace accommodations for pregnancy and nursing needs. We'll also provide a brief overview of New York's temporary disability insurance. That's the TDI that you might continue to hear the acronym for. This is a reform bill, and it's an urgent need for a reliable medical leave program, particularly for perinatal health. All right, so welcome.
Great, thank you so much. We can take it over from here. Hi, everybody. Thanks for being here, and thank you for all the incredible work you all do. I'm Mariah, and Jessie and I both work at A Better Balance, which if you can go to the next slide, Samantha, if you don't mind. A Better Balance is a national legal services and advocacy organization. We're headquartered in New York, but we work around the country. And we use the power of the law to advance justice for workers so that they can care for themselves and their loved ones without jeopardizing their economic security. And of course, this is not legal advice, but only legal information. And we welcome questions, but we will also flag that we have a free and confidential legal helpline that you can access by calling that number or visiting our website. And we have a QR code later if people have any individual questions. Could you go to the next slide, Samantha? The goals for today are to really learn an overview of the workplace rights for you, your patients, the people that you work with, you and your family members have to care for themselves and their loved ones, and also to provide people with information available to kind of see where you might be able to get any other legal information and to work with our helpline if you need it about your rights to paid leave, workplace accommodations, and more. And we'll also be talking about our plans for change because, as you will soon hear, our current paid medical leave program leaves much to be desired, and we're really pushing for change with all of you here. And Samantha, do you mind going to the next slide? This is just a little bit of information about our free legal helpline, which is free, confidential, available in English and Spanish, and can serve anybody regardless of immigration, citizenship status, income, or gender. So always like to highlight that. And if you don't get the number, it's on the bottom of all of the PowerPoint slides. I will pass it over to Jessie to get a little bit more in depth about what some of the laws and accommodations are available. Thanks.
Thank you, Samantha. Hi, everybody. My name is Jessie Workman. Like Mila said, I'm a senior staff attorney at A Better Balance, and really grateful to Mila and to this coalition for bringing us in. I felt really welcome here, and I've said this every time I've been here, but I had a home birth in New York and just feel really grateful for the work that you all do. And I'm glad that we're able to be here today talking a little bit about the Know Your Rights piece, because I think it's really, really important. And I think it's an area where it can be incredibly confusing trying to figure out what options are available during pregnancy and just in general. Like accessing leave and accessing accommodations at work can be a very confusing process. And there are a bunch of different laws at play. So I just want to reiterate one thing Mariah said. We Nothing today is legal advice, but we are happy to be overviewing all of this legal information. And for individualized questions, you're welcome. Questions can come in anytime in the chat. I love questions because then it gives me a sense of where people are, especially because I can't see you all. So if you have questions or comments, please have them coming throughout. And then our legal helpline is a really great resource for individualized questions. And a lot of what I'm going to talk about today is an individualized assessment anyways. So the helpline is really, really valuable for trying to figure out what applies in your exact situation. But what I want to do is just give an overview of all the different laws that can apply so people can leave with a basic sense of what the landscape looks like. And again, if it feels confusing, it's because it is confusing. There's a bunch of different laws at play, and we have federal protections, just meaning that there are federal laws that protect anybody across the country. And then there are state-specific protections, and we're going to talk a little bit about both. So I'm just going to talk about the laws that we're going to go over. Oh, one other thing I want to say before I step into this is when we're talking about taking leave from work, so not accommodations, but when we're talking about leave specifically, a lot of times we break it out between family leave and medical leave. And family leave is the type of leave that one would take to care for a loved one. So whether that's bonding with a new baby in the context of birth or a foster child, any new child that's come into your life, or whether that's taking care of a loved one with an illness, family leave is referring to caring for another person, a loved one. And medical leave, we talk about when we're talking about caring for ourselves specifically. So if I'm the one with a serious illness, including pregnancy-related illness or need for medical leave, then that's in the medical leave. So I think it's helpful to just to break them out, family leave and medical leave, and that's going to apply as I'm talking. But one of the laws I'm going to overview is the Family and Medical Leave Act. It's a federal law, and it offers job protected leave up to 12 weeks, but it's unpaid. And it's for family and medical leave, so both of those different needs. The Pump Act is another federal law and offers protections for pumping milk at work. And the Pregnant Workers Fairness Act is also federal and allows people to request reasonable accommodations at work for pregnancy. And New York State has its own Pregnant Workers Fairness Act, and then there are also protections available at the city level, but we're just going to be talking about the federal Pregnant Workers Fairness Act today. And then for New York specific laws, we're going to be going over the New York prenatal leave law that was enacted at the beginning of this year and essentially adds a 20-hour bank of sick time for people who are pregnant or people who are trying to get pregnant. And then I'm going to also talk about New York's paid family leave program and New York's temporary disability insurance program, which is our medical leave program. Next slide. Thank you, Samantha. Okay, so this is just to get a sense of where these different laws come into play. So even before pregnancy, some of these laws offer protections when a person is trying to get pregnant, whether that's using any fertility related treatments can be covered. And then once pregnant, there are a bunch of different laws that come into play. So a person may need medical leave or may need that prenatal leave, which is essentially sick time to go to prenatal appointments, or may need workplace accommodations. And then there's leave from work during pregnancy for medical needs, birth-related leave needs, leave from work to recover from birth or loss or bond with a baby. And then once returning to work, there are also accommodations that are available, including for pumping. Next slide, please. So like I said a minute ago, the prenatal leave law was passed it went into effect on January 1st, 2025. And the best way to think about this is as sick time. It's called leave, but it's not 20 hours is less than 3 days. So it's really sick time. And it's time that you can use in addition to the sick time you might already have to deal with pregnancy specific related needs. So that could be fertility treatments, prenatal appointments, etc. And it applies to full-time, part-time, and temporary workers, regardless of immigration status. It does not cover federal, state, and city workers or independent contractors. And on that independent contractor piece, we're going to go over that. I'm going to go over that a little bit more in a few slides, but many of these laws either don't protect self-employed workers or have different requirements for self-employed workers to access the protections. And this is not medical leave. And part of the reason why we have been repeating this, that it's not medical leave, is because New York has a subpar medical leave program, and Mariah's going to get into that later. And this 20 hours of prenatal leave it's very important, but it doesn't cover the need for medical leave. So, and it just very simple example of that. If somebody is told that they need to be on bed rest for the last few weeks of pregnancy, this wouldn't really touch that need. A person would need medical leave instead. Next slide, please. Okay, so under the Pregnant Workers Fairness Act, which is a federal law, workers have the right to request reasonable accommodations for medical needs related to pregnancy or childbirth. And this can be the type of accommodation. What this can look like can be very broad. So I have several examples up here: time off to attend prenatal or postnatal appointments, light duty at work, temporary changes to job duties, temporary transfers, modifications of work schedules, working from home, breaks to drink water, eat food, use the bathroom, and changes to uniform requirements. But that list is not limited in any way. So it's really important to think in this context of pregnancy accommodations. Once an employee asks for an accommodation, the employer has to engage in a process and a conversation to figure out what's possible and what this individual needs for their individual pregnancy needs. And it can look, it's limitless in some ways. It's not set to this specific list, but it's more of a dialogue to figure out what a person needs and what is possible. And unless there's an undue hardship for the employer, which would mean that it's very difficult or very expensive for them to provide. The employer has to provide the accommodations, and it's hard. It's hard to prove that undue hardship piece. And like I said before, there are additional protections in New York State. I will just say on this slide too, we're going to talk a little bit later about our resources, but we have a workplace rights hub which overviews the PWFA and has a lot more information. And again, if a person is told that they can't have a reasonable accommodation, or that what they're asking for would be an undue hardship and they don't think that's true, or that hasn't been demonstrated, reaching out to our helpline and talking through what's going on is a really good idea and a good resource. Next slide, please. Okay, so the Family and Medical Leave Act is another federal law. This provides leave either to bond with a new baby, to take care of a loved one with a serious illness, or to take care of one's own serious illness. And there's also military-specific protections under the FMLA. It's up to 12 weeks off per year. Again, it's unpaid. So FMLA leave it's an option that's really important to know about if one is in a position where they absolutely need to take leave and unpaid leave is the only option. It's job protected, meaning that workers have a guarantee that they'll get their job back and they should be returned to either the same job or an equivalent position. Retaliation is illegal. There are several eligibility restrictions. I think the important ones to know for this purpose is a person has to work for an employer that has 50 or more employees. So I think around 50 to 54% of the workforce in the United States is eligible for the FMLA leave. So it's a lot of people are not eligible. And then there are a few other eligibility requirements that we don't need to discuss today. But again, we do have more resources if a person is trying to figure out whether they are eligible for the FMLA. Next slide, please. One more thing about the FMLA, just in the pregnancy and birth context, that leave could be used to take care of one's own medical needs that come up during pregnancy, and also used to bond with a child. And then in order to take FMLA leave, and this is also true for medical leave in New York, a person has to have a serious health condition, and serious health condition has a definition. So it's an illness, injury, impairment, or physical or mental condition that either requires inpatient care in a hospital, hospice, residential care facility, or there's continuing treatment or continuing supervision by a healthcare provider. And this includes mental health treatment. It also includes many different kinds of treatments. So if a person has an accident or surgery, it covers gender affirming surgery. It covers many different kinds of pregnancy needs, but one would just need to meet that definition of serious health condition. And both the FMLA and New York's medical leave program require paperwork from a healthcare provider. Next slide, please. Okay, so next I'm going to talk about New York's paid family leave program. And A Better Balance worked a lot on getting paid family leave passed. In 2016, New York was the first state to adopt a paid family leave program. And at this point, many other states have as well. And unlike the federal program, this offers paid leave. So it can be used to care for a seriously ill family member, bond with a new child. And again, I said this before, but that would be like a child through birth, or an adopted child, a foster care child, any child that has come into your life, and for certain military or family needs. And it's up to 12 weeks per year. It can be taken intermittently, meaning it can be taken in chunks. So it could be like a couple days at a time, a couple weeks at a time. And oftentimes people break it up depending on their need. It's 67% of a worker's average weekly pay, up to around $1,200 a week. And the employer can always pay more. Many employers do supplement that, but that's the state program allows for 67% of pay, up to $1,177 a week. And it is job protected, and retaliation is illegal. Next slide, please. On that last slide, no need to go back to it, but we do have information about how to apply for paid family leave. And New York State has a paid family leave website, which is relatively, it's easy to access the website. The application process can be difficult, but it does go over the requirements. And again, we have resources that cover them more in detail. And then I just wanted to touch on a little bit special considerations for self-employed and workers, including freelancers, independent contractors, anyone who isn't an employee. The FMLA doesn't cover freelancers at all. New York does allow for self-employed workers to opt into paid family leave and our TDI program. And they have a kind of a strange requirement. So as a self-employed worker, freelancer, independent contractor, if you opt in the first 6 months of becoming self-employed, then you can be eligible after 6 months. And that's the same thing is true in New York's paid medical and our family leave program. I didn't say that a minute ago, but I think it's important to touch on, and then I'll continue this piece. So to be eligible for our paid family leave program, a person has to have been at their employer for 6 months. And especially in the context of pregnancy, that is a relatively ridiculous requirement. And it's something that we've been trying to change, because one can't predict when they're going to become pregnant, but that is the rule. So the rule is that you're only eligible for a paid family leave after you've been at an employer for 6 months. So this is, for freelancers, they're copying the same rule. So if you opt in, and there's also the option is on the website, you basically start paying into the program as a self-employed worker. If you do that for 6 months, if you do that within the first 6 months of starting your business or becoming self-employed, then you can access the leave within 6 months. If you wait, and I would imagine a lot of people wait because they just don't know the program exists. But if you wait after that 6 months, then there's a 2-year waiting period. And again, that's something that we've been advocating to change. And I don't know that it's going to change this year, but it is something that we would want to change in the future. But just to repeat that, if you're self-employed, if you start paying into the program, if you opt in within the first 6 months, then you can get paid family leave after 6 months of paying in. But if you wait after 6 months from being self-employed, then you have to wait 2 years. And this QR code goes to ABB guide for accessing paid family leave for self-employed workers. You can go to the next slide, please, Samantha. Thank you. All right, I'm going to hand it over to Mariah to talk more about our temporary disability insurance, our medical leave program. And please, if you have questions on anything I've covered or anything Mariah covers, please put them in the chat. Thank you.
Thanks, Jesse, and thank you again, everybody, for being here. And I do also want to say, I know all of this is incredibly complicated. There are so many different laws, and it's really a lot of information. So again, happy to also keep sharing. So I'm going to get into a little bit about how New York's paid medical leave program functions. It's known as the Temporary Disability Insurance Law. It is essentially functions as New York's paid medical leave program. So New York's TDI program provides payments to people who are temporarily unable to work because of serious illness or injury. And that includes any kind of pregnancy-related complications that would mean that you would need to take time off of work to take care of yourself. It also covers anything like any kind of mental health crisis or any other medical condition like cancer or any other treatments that you would need. Which the problem with this is that it only provides people with a wage replacement rate of $170 a week for up to 26 weeks. $170 a week is just like a completely absurd amount of money to provide people with when they are taking time off of work to care for themselves. But to make matters worse, this leave is not job protected, and your employer is actually not required to continue your health insurance. So we have this really unworkable program, and this is the leave that you would take when you need to take time off to care for yourself. So anything that you would need for you yourself, you would be taking TDI, which is this really unworkable program. Next slide, Samantha. The one piece of information here that is kind of, we have these two very different programs for the paid family leave and TDI. And with TDI, one thing is that the eligibility requirements are actually a little bit less than what our paid family leave requirements are. So you only have had to work for your employer in New York State for 4 weeks in a row, or if you're a part-time employee, 25 days in a row. This doesn't cover government or city workers, but nearly all other sectors are covered by TDI. Next slide, please. And I worked in case management for 5 years, and I had never even heard about temporary disability insurance as a program before. And this is essentially just to kind of hone in on this, the difference between paid family leave and paid medical leave, TDI. TDI can only be used to take care of yourself during a period of serious illness or injury. It goes up to 26 weeks, but again, it's at $170 a week and it's not job protected. And if you're taking care of another person, that means that you're eligible for paid family leave with better benefits compensation. But this TDI is really only when you are taking care of yourself. Next slide, please. So this current program is really completely unworkable. There is not a single person in New York who would be able to live off of $170 a week, let alone somebody who's taking care of a family. That $170 is really almost a joke to kind of offer people, particularly when they're in the middle of a health crisis and potentially when they're also facing something like losing your job and your health insurance. So A Better Balance and other members of this great coalition have been working to try to make sure that we can have a real paid medical leave program in New York. Right now, that legislation is A84, which is sponsored by Assemblymember Szilagyi, and in the Assembly and in the Senate, it's S172 with Senator Ramos. And what this would do would take away that $170 a week cap and raise the wage replacement level, raise the wage replacement level up to match what paid family leave is. Part of the problem right now is that lawmakers wrote in $170 in 1989, which is why we've been stuck at that number since 1989. And we're going to make sure that that we don't have that like number that's stuck, and rather we'll have something that indexes for inflation and changes with the times, which is what our paid family leave program currently has. So ultimately what we're going to be doing is making sure that these programs are matched and that they're the same. It would also ensure that people are able to take leave intermittently, meaning that we can have people taking a week on, week off, go back to work, make sure that there's job protection, and also make sure that there's a guaranteed continuation of health insurance. And we will be at the Day of Action, and really looking forward, in case anybody has any other questions or ideas, and would like to connect with us at any time to make sure that we can get this across the finish line. Next slide, Samantha. And this is just a couple of pieces of information about our free legal helpline. And this QR code will bring you directly towards the Workplace Rights Hub, and can give like kind of any other valuable information about what specifically your rights are. And I did see in the chat that does TDI cover mental health crisis? Yes, it does. TDI covers anything that you yourself would need to take time off of work for, and that does include mental health. It also does require medical documentation. So that's really, as long as you have somebody who is able to provide you with that documentation, yes, it does cover mental health. And I can pass it over to Jesse in case I missed anything, but thank you.
Thank you, Mariah. I see one more question about whether freelancers can participate in TDI. And the answer is yes. So when you opt into paid family leave, you opt into TDI as well. The opt-in is for both programs, and then you have access to both. And I'm going to put the link. Well, I'm not really I'm not sure the best way to share the link, but I'm going to put it in a private chat so it could be shared here. Just the state's website on opting in for self-employed and freelancing individuals. And if there are any other questions, now would be a great time for them. Again, thank you so much for having us here and for listening to our presentation. We're also available outside of this. Like, we do have our helpline and people can reach out to us. We can connect people directly if that's helpful.
Hey, Jesse and Mariah. I just wanted to say thank you again so much for joining us today and for everything that you've been doing to advocate for pregnant, birthing, and postpartum families in New York State. It has been an absolute pleasure for us at Push to work with you guys, and we're really excited to go to Albany with you next week. I know we have some additional content planned for today, but Mila, we somehow lost Mila in the backstage area here, so we're waiting for her to log back in. Oh, I think that might be her. Yay, there she is. Okay. Hey, Mila, you're here.
Hi. Thank you. All right. So that was very informative, and I hope people will continue to stay in touch with you guys, especially as you've mentioned, it's so comprehensive, and the detail to which one may need to navigate could require some support and connection with an organization like yourself that has been really instrumental and deeply involved in understanding it all. So again, thank you for you and your teammates and all the supporters who've worked very hard to make this a reality. And like Samantha said, I'm very excited for all that's ahead in our collaborations.
And Jesse and Mariah, before we move on, I see there's one additional question. Can you please talk a little bit about how New York State compares to other states when it comes to workers' rights during pregnancy and postpartum?
Yeah, I'm happy to start this question off, and Mariah might have things to say too. We have lots of thoughts about this question.
I can tell from the expression on Mariah's face.
So like I said earlier, New York was the first state in the country to have a paid family leave program. And it's a really important thing. I mean, in a lot of ways, we kicked off having paid family leave, and then other states followed. And while that was in 2016, and when that happened, we had this really old medical leave program, which we call TDI, the Temporary Disability Insurance Program. And we didn't bring it up to be equitable with paid family leave. So it's been really untouched, as Mariah said, since 1989. So one thing that New York has that other states do not have is this extreme disparity between our paid family leave program and our paid medical leave program. Mm-hmm. And whether it's purposeful or not, it means that if you are caring for yourself, you get $170 a week. And if you're caring for another human being, you get almost $1,200 a week. And that says a lot about how we think about caring for ourselves versus others, whether that's intentional or not. But that's the first thing that comes to me just around how we compare with other states. We have this disparity that really needs to be fixed between these two programs. In the family leave context, 13 other states, including DC, have paid family leave programs. That might be 14. I think New York is one of 14, including DC, with the paid family leave program. And then there's an additional state with the paid medical leave program, which is Hawaii. If you're looking at, again, like if we look at the landscape of medical leave specifically, New York is far, far, far behind every other state with a paid medical leave program. Far behind. $170. I think the next highest state is Hawaii, and it's around $800. And all of our neighboring states are more like $1,000 plus for what a person gets weekly. But if you look at paid family leave, we're a little bit more like we're not the best state in terms of what we pay and all the protections, including like we require 6 months of working at a place. That makes no sense. And a lot of other states don't do that. But I would say in the family leave context, there are so many different aspects to these programs, including what the benefit amount is. And so we're more like in the middle to a little, the middle of the pack versus like being at the very bottom with our paid medical leave program. I don't know if you want to add anything to that, Mariah.
Yeah, I'm agreed with everything you just said. And also just to kind of highlight the fact that our neighboring states have real paid medical leave and real paid family leave programs. New Jersey, Connecticut, Rhode Island, and other states across the country. So it's not, we're really just trying to advocate for something that is, at this point, something that is a very basic right that all workers deserve. But it is not something that is really asking for like a pie in the sky. There are states across the country that do this, states that we are literally border. And it's just absurd that at this point we continue to have this extremely inequitable program where if you're taking care of another person, you're able to receive real wage compensation, guarantee of your job, and a guarantee of your health insurance. So it's just, New York really needs to catch up. And so we're hoping to make that happen by the end of the year.
Yes, indeed. Thank you for answering the questions that have shown up in the chat. And again, thank you so much for sharing this valuable knowledge. So right now I'm going to hopefully maybe briefly go into the second item of what we hoped to discuss today. And as you can see from my banner here, I wear different hats. And while I am the executive director of the Birthing Place Foundation, I also am president of the New York State Birth Center Association. So what I would like to share with the folks today, depending on how well informed you are about the history of birth center access and the options and the legislative progress in recent years, I can give a brief overview, but quickly wanted to make mention that the Birthing Place, with our track record of collaborative programs, which I have discussed in a previous teach-in, ultimately is working to expand from education and wellness, womb bus, Mariam Reproductive Health and Wellness Clinic, to having a birth center. We are on track, hopefully, to open a birth center with a medical director who happens to be an OBGYN, Dr. Carla Williams. Now, I want to acknowledge, as much as I respect Dr. Carla Williams and her incredible journey and understanding of midwifery care and respect for the midwifery model of care, in that she has also chosen home birth multiple times for her family, for her births. It is still worth acknowledging that it is not appropriate or fair that an OBGYN needs to medically direct a birth center. For that reason, we continue to fight and fight hard so that the original intent of the bill that was passed in late 2021, which was to allow for more midwifery-led birth centers in New York State, for that bill to that would serve our state. And unfortunately, it has not. Since the passing of that bill, there has been no progress. If progress is measured specifically by having more licensed birth centers in New York State, we are lacking. Okay. We have not made any progress in that way. So all to say that the fight continues, and we want to ensure that other folks who are working to open birth centers, who have a more longer and strong expertise in out-of-hospital birth, be positioned to open birth centers in their community. That's the discussion point right now. So hope that gave a little information. And I think what I want to offer is that the New York State Birth Center Association membership met this month for the first time in 2025. And we have been, for the year so far, just wanting to uplift other initiatives that pertain to maternal health, like the ones you've been learning about in recent weeks of teach-ins. And now we are unanimously interested in addressing the certificate of need as part of where the previous legislation fell short. So again, just a little bit of history. We had a bill that passed unanimously through the Assembly and the Senate, which allowed for the Commission for Accreditation of Birth Centers, which is a very comprehensive accreditation. If one receives that status on a national level, that it would be deemed eligible for licensure here in New York State. So as that was being signed into law after it passed in the way that we had intended it to, unanimously through the Assembly and Senate, in the executive office, it was changed and then passed. And that change really was unfortunate in that has led to the certificate of need still being a huge barrier. What is a certificate of need? It's a regulatory requirement in the US that aims to control healthcare costs and ensure that healthcare facilities or services meet the needs of a given area. And in the context of birth centers, a certificate of need, which I'll just call the CON, C-O-N, con. It's just so fitting, by the way. A con requirement, it basically means that a new birth center must demonstrate the need to the state or local health department that there is a need for its services in the area, and it cannot duplicate existing services, aka hospital services. So if it cannot duplicate hospital services in hospitals, catch babies also, but it's obviously a completely different service. This basically involves, it restricts the ability for birth centers to exist. Okay, so that's the idea. It can involve providing data on local populations' healthcare needs, the availability of existing services, and the potential impact on the local healthcare market. It's lengthy, it's costly, it requires birth centers to provide detailed financial and operational plans, as well as undergo public hearings and reviews, which have proven to be unfair in one of the efforts already made in New York State. We would argue that the CON process creates barriers to entry for new healthcare providers, particularly in underserved areas, particularly in midwifery supported people, folks of color and marginalized communities and areas, some of the areas that need it most. So let's see, and we already know that, we need to not limit this option and really create more innovation in the healthcare space. So now I'll summarize that. In short, the New York State Birth Center Association wants to create legislation that meets the gap of where the other legislation fell short. And we'd like to hire a lobbyist to help us strategize on what kind of approach and what supporters we can have basically for the remainder of this season through July. We also are curious if people had any input, basically, when it pertains to like ideas. I think someone once mentioned being ready to send messages to our legislators about the need for birth centers. We haven't done this in years, really. And so I wondered if people would be interested in that. Should we create templates for individuals from the community, right? From individuals who are birth workers and serving the community, and from institutional organizations to create letters of support for this need, if that can help add to our amplification. But yeah, let me see if there's anything in the chat that I might address. And yeah, okay. So I'm hoping that those of you who've heard what I just said, have an inner yes, and you're going to be willing to engage. And thankfully, in my last visit to Albany, when I provided testimonial on the state of maternal health in New York State, I was able to mention this briefly to many supportive individuals, Jessica Gonzalez Rojas, Mikhail Solanges, and several more folks that are too many to name. So we're hopeful, but we also need to make sure that our community is engaged. All right. So let's see here. I see a question in the chat. Where can we engage? Thank you. Awesome. Wonderful transition, because we can let the folks who might be backstage into the space. The short answer to that question is we're having our Maternal Health Day of Action on March 26th. And that is one way that we can engage, as well as, oh, hi, folks. I see people entering. And so that's one way that we can engage, and we'd love to share more about what's happening on the Day of Action. And you can think to yourself, what's your story that you can add to individualize your template, individualize our template into a meaningful letter to your legislators. And I'm going to pause here and pass it to you, Samantha, if you'd like to introduce more about our Day of Action. And I see our faces of some of the organizations that are really important parts of the initial growth of MMHC.
Thank you so much, Mila. And thank you again to A Better Balance and to all of the Mobilized Maternal Health Coalition members we have here today. I think my face is covered by the thing. I'm going to take this down for 1 second while we're talking. So we would love to have anyone and everyone who is available join us for our Day of Action next week, which is Wednesday, the 26th. And you can do this either by coming to Albany with us if you are available. But we also know that that's not super easy for anyone who has a job or a family or a life. So if you cannot, we want to make sure that everybody knows that there are many ways that you can participate remotely and really have a really critical impact. And so I guess that's kind of what we want to talk about here for the last few minutes of our teach-in, is what are the different ways that people can participate in the Day of Action next week, depending on what your availability is and how do you get involved. So I'm going to first put up on the screen really quick so that it's handy, the form where you can RSVP. So as we're talking here, if any of this sounds like it would make sense for you and something you want to do, please fill out that form, because that will come to us and let us know what you're interested in so that we can loop you in with the team that is organizing everything. So when we are in Albany, so next week, it's going to be, again, the Wednesday, the 26th, we are going to be meeting in Albany first thing in the morning. If you're coming from the New York City area, carpools will be leaving at 6 a.m. So it's going to be bright and early, road trip. So we can provide transportation if that is helpful. We can also help you find trains. There's a train that goes direct up to Albany, and we'll help you do the transfers and stuff like that. You also have the option, if you wanted to go up the night before, we can help you find hotels. They're very reasonable there. So lots of logistical support. You're not on your own here. And once we get to Albany, we have a spot that we can put all of our stuff in a safe location so we don't have to carry everything around all day. And at 10 a.m., we will be doing a live press conference from the $1 Million Staircase. And so we're going to have banners, we're going to have signs, we're going to have all that good stuff. And we're going to have lots of speakers, both from the maternal health advocacy community and also from the legislative sponsors of the various bills that we are all there to support. and we will be streaming that live again through the same places that you're watching this right now. So if you're watching this on YouTube or on Facebook or on Instagram, you will be able to find that in the same location. And we would love, again, to have everybody watch live, share out the recording once it's out there, and join us to help amplify. After we finish the press conference, we are going to break into teams. And again, all of this will be organized for you, so you don't have to worry about it. And you will basically, we will have meetings with legislators. We will just be dropping by to say hi to people. We will sit down and have a nice lunch together. We will be taking lots of pictures and videos for social media. And if we're lucky, we will even get hopefully some media coverage there to talk about the state of maternal health in New York State. And so, so more information come about all that. And if you just fill out the form, again, we will loop you in all the planning. And then, what if you can't come to Albany? I think that's okay. There is, again, a ton of things that you can do that would be super helpful. Number one is if you sign up on that form and say that you want to help support remotely, we will make sure to be in touch with some very clear calls to action. And we haven't determined yet what those are, because if you don't know, right now is budget season in Albany, which means our representatives in the Senate, the New York State Senate, and the Assembly are negotiating with each other behind closed doors. Even their staffers in many cases are not allowed in. And so they're trying to figure out the budget that they can present a unified one-house budget to the governor and then negotiate it with the governor, and everybody will sign off on it. And there's an opportunity to include some high priority legislation in there. And we are very hopeful that some of the initiatives that we have been supporting through the Mobilized Maternal Health Coalition will be included there. And so, because we don't really know what the status is right now, we are basically waiting to hear, because there's a lot of moving parts. Things are changing very quickly. And so we honestly probably won't determine until a day or two before we go to Albany what that call to action will be. But it will be something like, call XYZ representative and read this, script to ask them to, support this bill or talk about maternal health on the floor, or whatever we determine it will be. But it'll be simple, quick, take less than 2 minutes. And so we would love to have everybody on deck to do that, and to help us share, because again, the more people that we have calling in or posting on social media and tagging our representatives, the more likely it is that they are going to see that this is something constituents are calling for, and really push it forward for us. The other thing that could be really helpful remotely is to be kind of like our help desk support person. So it's always great to have some people who are not in Albany but know what's going on there and can help people, because number one, the buildings are confusing to navigate, and it's easy to get lost or be like, I can't find the rest of the team, or I'm in the legislative office building and there's no service here, so I can't get in touch with anyone. And to have somebody on the back end that you can call at any time and be like, hey, can you help me figure out what I should do next to make sure I'm using my time most effectively? And so you could be one of those people for us, and just kind of, while you're going about your life that day, just be on call, so that if anybody who's up in Albany is like, okay, I finished all of my meetings, I'm not sure what to do now, you can give them a list of office numbers they might want to swing by, things like that. So, and then of course, again, just amplifying. We're always saying this at Push, and it is true that liking, commenting, sharing, saving stuff on social media really, truly does make an impact. This is how we get these issues in front of other parents, in front of birth workers, in front of doctors, and in front of politicians who are in charge of making the policies. And the algorithms, unfortunately, in many cases are are working against us, because we are talking about things like reproductive justice and women's health and, all of these terms, which apparently are now being banned all over the place. And so what's really going to make the difference is individuals sharing to their networks. And so, so we need you guys. And any way that you're able to support, we would absolutely love to have you involved next week. So fill out that form, please, at bit.ly/March 26th Day of Action. Let me also put up the...
While you grab that, beautiful. We can add the bit.ly in all of the communications. We hope that you will share that bit.ly as well to others. If you can't go and you know someone who lives in driving range, or another set of people who you want to join, we hope that they do, because we know that this matters to us all. So just wanting to reiterate the amplification efforts, and share those of you who will be present remotely. We appreciate that. And anyone who's going to make any effort at coming in person, your bodies, your holding of your experience is so valuable. And also, if you can join one of the meetings, because we are going to have several meetings with our legislators, you might have a particular story that lends well to one of the specific topics we're talking about, be it stillbirth or, wanting to support families in more settings, birth center settings. So we want to put you in a useful place so that you can use your voice as well. And just another couple pieces of idea when it comes to what the remote versions of support can be, in addition to sharing, commenting. There could be something where we make our own signs, be it a graphic version of a sign that we hashtag, use the hashtags. There are two, which we'll drop in the chat. And I believe it's, I'm going to actually be careful, because I think that there are two on our website that we put. There we go. Power to Mobilize and Maternal Health Justice. So we hope that we can do that and tag some of the organizations involved and our legislators. We might request for you to tag people under some of our posts. These are ways to engage. And so also, I would say we really appreciate all who filled out our form and who are staying in touch. You are so valuable in this movement, and we hope that more people, if you could share that form as well, the MMHC Connect MMHC. We have a bit.ly form that you can stay connected well past this day of action. And we know that we'll keep people posted with all of the ongoing work in progress. And if you, when you fill out that form, want to share whatever skills you have, video editing, graphic creation, organization, what have you, whatever skill you have, we know that this has been an incredible group of people that somehow we keep filling in more gaps. And if you have them, grant writing, we still have yet to create a fundraiser. We're doing all of this just straight out of thin air. It's and, we ordered, posters and stickers and, T-shirts, but we're kind of knowing that that's one of the upcoming things that we hope we can engage some folks to just, have a modest amount where we can at the least break even for all of the efforts that we're engaging and making sacrifices that we can team up and get our community to also be involved in the fundraising strategy. All right. So that's what I hoped to add. Did anybody else want to add more before we sign off?
Yeah, I just wanted to say that all of the resources shared today will be available as a follow-up on the MMHC website. And for those of us who can join us in Albany, it'd be amazing if you could make a sign. If you can't, we will have them. And remember, no sticks or posts, so just the board for safety reasons. And yeah, if you can make it, that would be great. It would be such a lovely way to learn more, reconnect, and meet each other in person.
I know. Yes, I'm still looking forward to it. And also, so you guys know, like, it is, this is a family friendly thing. Like, if you have a baby, my kids might actually be playing hooky from school to come exercise their First Amendment rights. So like, you can bring people along. It is not, you do not have to have any experience. And all are welcome. You know, everyone has a story to tell, and your stories are the most powerful tools that we have to create change. So so we would love to have you join us in whatever capacity. Thank you. All right, I think we're all set. All right, thanks everybody. Thank you so much.